Good evening. My name is Jennifer Heck, and I welcome you to the Columbus Aesthetic and Plastic Surgery Ultherapy virtual event. Um, I must say that we miss you all. We are used in the past to having a lobby full of refreshments and appetizers and doing lunch and learns and evening cocktail hours. But we're absolutely thrilled that you've given us a chance to come into your home and share with you some information this evening about Ultherapy. What we'll be doing for the next 20-25 minutes is sharing the science of Ultherapy, what you can expect, what it's like when the outcomes come to fruition. So I hope you find it informative in the comfort of your own home. I want to let you know that we've been doing Ultherapy since 2017 here at Columbus Aesthetic. We have a team of 5 providers, nurse providers that provide our Ultherapy services. Some of you may already know those providers. One is Jackie Smith, our nurse practitioner, Caitlin Heilman, Tamara Donner, one of our estheticians, Michelle Sloan, one of our wonderful nurses, and myself. So if you haven't met us, we look forward to meeting you in the future. And like I said, you may know some of them already. Ultherapy's actually been around about 12 years, since 2008. We actually decided to purchase this device because in the practice we were lacking something to go down beyond the surface of the skin, deeper than a facial, deeper than what lasers can do, and really have another platform that our clients were really seeking, because I think for skin lifting and tightening, we all want that as we age, that's for sure. So as we go through the next several slides, I'll try to give you an illustration and education about the science of it, what happens to our skin as we age, and why this device helps us achieve the goals that we're looking for. So oftentimes with Ultherapy, you really want to think about collagen. I think in this day and age, I think there's all the hype about collagen supplements and whatnot. But this is actually a device that goes down and stimulates that lattice work, that structure beneath the skin that we need to maintain our youthful appearance. That's a natural protein that the body creates. It's what gives our skin that firm and toned appearance. Unfortunately, as you know, as we age, and they say about 1% per year in our mid-20s and beyond, unfortunately, the collagen breaks down over time. And in that, of course, we see a loss of skin strength, elasticity decreases, and that's what happens when we get our visible signs of aging. So in that illustration, the first one on the left, you're seeing that lattice work in a healthy presentation. So youthful, and unfortunately, like we said, over time, of course, we all know, we see a decrease, sort of a relaxation in those structures. So if you think of it in a real simplistic term, think about the strength, the mattress, the base of the mattress of our skin. If we think about the top of our skin being the top and this lattice work being at the bottom, over time, that relaxation causes our skin to be lax. So when we talk about the signs of skin aging and when that really comes to fruition, the illustration on the left is more like a client that's in their 20s, right? Your skin is firm, it's plump, it has volume in all the right places. And I would say that client is obviously very mild laxity, if any. The middle picture, of course, is when we see clients about in their 40s to lower 50s, and we would stage that as a moderate laxity, where we're starting to see lines and wrinkles, a little bit of drooping in the cheek area. Sometimes we lose volume there. Of course, we all lose volume where we don't want to, unfortunately. We start to see some eye hooding where that like your eyeshadow is just starting to appear a little bit more cakey. We have lines and wrinkles between the brow and the lash. We can often see sagging neck area from the chin to the collarbone. And then unfortunately, if you haven't heard of the term jowls, this is the area we'll be referring to from the corner of the mouth outward towards the cheek. So Ultherapy is great for mild to moderate laxity. We'll end up going through photos that illustrate what it can do for mild to moderate laxity. When we get more in an advanced lax position and the illustration on the right, I say we definitely have conversations with our clients about whether or not Ultherapy is the right option for you. Usually it's not going to quite achieve the goal that the client has. Sometimes clients in that stage of laxity still want Ultherapy because they perhaps don't want a surgical procedure, and that's okay. We're here to educate and let you know, depending on your goals, if this is the right option for you. But it's definitely, its wheelhouse is that mild to moderate laxity. Let's talk about the science, and I briefly referred to thinking of the layers of the skin like a mattress. So the top illustration is where it's showing you the top of the dermis. In between, just sort of think about that as a fatty layer that we all have. And then the little white fibers on the bottom, that's that collagen layer that we actually want to target with Ultherapy. That's the part we want to deliver our micro focused ultrasound energy to stimulate that area, thus causing neocollagenesis. So what happens is when we're delivering those thermocoagulation points or the heat points of Ultherapy, it essentially is stimulating that area to break down, and in the rebuilding of it causes the lifting and the tightening. So let me repeat that, because this is what makes Ultherapy unique. It uses ultrasound energy. All of us are familiar with ultrasound technology, but in this device, it harvests energy using visualization with the ultrasound energy, and it allows us to deliver those thermocoagulation or heat points down at the base layer where we want to stimulate the collagen. The last illustration there gives you an idea of when that lattice work is strengthened and tightened over time. Generally, it starts to become evident about 3 months, with the best results around 6 months. So it's definitely not an overnight thing. So we'll talk in a little bit about what you expect and when you expect it. So generally that's what we see, and it just takes time. Of course, we didn't get a breakdown of that collagen overnight. It doesn't regenerate, of course, in a really short term. So we would also want to educate you on timing of Ultherapy, what and when you're going to expect your outcomes. Why choose it? We actually decided to buy Ultherapy in 2017, like I mentioned, because we didn't have a platform for lifting and tightening that was non-surgical. But the other big reason we also did so is because at that point they had a technology upgrade where we were able to see the layers of the skin by the ultrasound. So it's had great outcomes for years. It's actually won the New Beauty, which is a #1 cosmetic forum. It's a magazine that we use along plastics, derm, and in aesthetics. It's won the #1 New Beauty award for several years running for the best non-surgical lifting and tightening device. So, who knows what it's going to be, 5 and 10 years from now. Medical technology is absolutely changing all the time. If you're one of our clients here, you'll know there's we're pretty particular about what we purchase. We don't want to have every single device that's out there, but hands down, Ultherapy had several years of having great results before we decided to enter the arena with Ultherapy, and we've been really happy with it, and we're obviously going on 3.5, 4 years. So only Ultherapy, what makes it different is it's the only device that treats using ultrasound technology, allowing us to customize what we see on each individual patient. It's the only non-invasive, and it's actually an FDA-cleared procedure that goes deeper to lift the neck, chin, the brow, and improve lines and wrinkles on the upper chest. So we will go through a little bit more about what areas it can treat as well. The visualization on the slide here is actually what we as the nurse provider see while you're laying down in much like a facial position. That top layer is showing you what we see, and it may not seem like much, but it's actually, we actually really love it. I say us girls it's fun when you actually get to see underneath the skin and really understand where you're going with the energy. It allows us to see where your base layer is. Someone like me may have a base layer of 3 millimeters. Someone may have a little bit more volume in the cheek and may need 4.5 millimeters for their base. Just know that your nurse provider knows how to read the ultrasound We do lots of education and training, certification to be able to provide Ultherapy. The computer actually keeps track because in some cases, we're actually delivering the energy and manipulating our transducer over 1,000 times. So the computer illustrates for us the mapping and allows us to keep track of where we're at in any given treatment. So it's really fail-proof in as far as guiding us on how much energy is supposed to go in which area. So it allows us to map that out for you. Let's go into the science. We briefly touched on that collagen stimulating base, but this illustration really gives you an idea of what makes Ultherapy different. So now when we go from the left to the right, let me briefly describe for you what is different than perhaps some of you may have had surgical procedures in the past on the face or neck. Some of you may have had lasers. We offer BBL, halo, combination laser peels, other intensive treatments for the surface of the skin. Radiofrequency is more of a diffuse heat, and then we have Ultherapy. So of course on the left, you're seeing surgical facelift, of course, is still the gold standard for skin lifting and tightening in a surgery technique. Where Ultherapy comes to play is you may not be quite ready for surgery yet. Perhaps it's not actually physically indicated, where 30s, young 40s, you may be coming in and thinking, hey, I want skin lifting and tightening. Do I need surgery? The physician may say, hey, you're not actually quite ready for a surgery for that. And so there's other non-surgical things we can do until these things don't meet your goals. So obviously you're going to go much deeper into the surface of the skin with surgery. The second column is laser, and you can see there that lasers can innervate about the top 1 to 1.5 millimeters of the skin. Okay, so it does an amazing, wonderful job. If you're unfamiliar with lasers, I think another way to think about it is if you have fine lines, pores, wrinkles, texture issues on the surface of your skin, lasers, and of course, esthetician, facial, microneedling, things like that, which of course we absolutely have here. Lasers do a wonderful job for the outward appearance of your skin. So fine lines, pores, texture, okay? So if you're someone who has a big event and you want your skin refreshed, or you want to resurface the top, that is a laser, and that would not be Ultherapy, okay? So radiofrequency, just to give you an idea, because there's definitely been products and devices in the past that have used radiofrequency energy. That's been used in medicine for quite some time. And we actually have radiofrequency energy in many of the devices that we have here. Some of you may be clients in our facial and esthetician area of the practice in the medical spa. And radiofrequency does do some lifting and tightening, but just not at the depth of Ultherapy. Radiofrequency is part of the Vivace, which is a microneedling device. And when the microneedles go down, it delivers radiofrequency. So we always say, you want to hit dual planes of the skin, and all these things are wonderful. But where Ultherapy has its sort of day in the sun is that as you see there, those orange dots, we can deliver the energy down to the base, right above the muscle layer, within the fat and connective tissue, and then stimulate the dermis. So that's what makes it unique. The top picture here, I love this one because it sort of refers back to those energy photos, but the top, it's odd because I'm used to you sitting here, so I would normally point to you to share with that, but the transducer actually lays on the top of the skin. So this is showing you that we basically contact the skin, and the energy that we see goes down to that samaz layer, which is platysmal bands. It's the fibrous collagen layer right above the muscle. The picture on the lower part of the slide I love as well, because when we deliver the energy, say we press the button, okay, it delivers the energy from left to right along the transducer, and basically we're laying that energy and mapping it all along your treatment areas, which if you look at that illustration on the lower slide, you can see all that micro-focused energy The dots represent every thermocoagulation point that we actually lay during Ultherapy. So you can see where we're actually giving you over 1,000 points of energy in some treatment plans. And it all depends on what you're doing. Some clients just want to do a brow lift. Some clients want to do jowls. Some clients just want to do the jawline and below and do the neck. And some clients just want to do the chest. Any of those combinations are excellent. And of course, everything's customized to, what your problem areas are and what your goals are. From left to right here, it just sort of confounds the point that once you do your individual assessment with your nurse, we do complimentary consultations, and we schedule out 45 minutes to really understand, what you've done in the past, what's working for you, what your goals are. We make sure that you're going to be happy with the outcomes that Ultherapy can give you. And then these are just examples of some of the treatment customization that you may choose. We, of course, then know how to determine the right amount of energy and whatnot, just from our training and certification. When we talk about results, I think we all want to see really what does it look like. So I'll try to share the stories of our clients and the illustrations that Ultherapy provides for us so that you can hopefully resonate at home with your body type, or maybe what's going on with your skin and maybe the lifting and tightening that you're desiring. So early laxity, of course, that top client, that's really where we're seeing clients. Unfortunately, there's a new term out there now, just with all of us being in our cell phones and looking down at our computers so much. Early laxity, obviously 30s, young 40s. Sometimes we're just seeing small and subtle changes under the chin where people desire a more lifted, toned, contoured chin area. And that obviously does a very nice job because they've also got age on their side and they've got elasticity that just rebounds better than if we're in an advanced stage of laxity. The lower picture, of course, shows someone that I would say has advanced laxity, of course. But you can see there that it still makes progress. It's all about, is that progress the right option for you? We have some clients that are advanced and they just really don't want surgery, and that's okay. Our job would then be like, okay, what can we do non-surgically to help you feel like you're making progress? Something's going to make you happy, feel a little more youthful, a little more refreshed, but still look like you, but not have to go under general anesthesia in some cases. Sometimes clients want to know, well, of course, everyone wants to know, how often do I do Ultherapy? Generally speaking, clients can do this treatment once every 1 to 2 years. So sometimes it's just based on, I always say life is life, right? Maybe sometimes you're doing a laser in between. Maybe you're doing facials. Maybe you're keeping up with your Botox and filler. I think what makes Ultherapy great is when you use it in combination with facials or injectables from our physicians, or laser treatments. Ultherapy is one of those modalities that it's a great maintenance, strengthening, lifting and tightening from the base, and then you add in other things to make you refreshed from the surface. But generally speaking, no one really does it earlier than a year. I would say the clients that really like it, of course, do it every 1 to 2 years. So. This shows you all the areas in which we can treat. And that basically, think about it, it can go from the top of your forehead all the way down to the chin, up underneath the chin, which we call the submental, all the way down the neck to the clavicle or the collarbone, and then an upside down triangle in the chest. So basically think about the area from the collarbone, sort of over the sternum or your chest bone, down to where the cleavage meets. So sorry, I sort of transitioned quickly into there. So, and if you have questions about any of the science part, we can get more in depth. Laura, my event coordinator, program coordinator, will be asking questions at the end. So if there's any part of that you want a little more detail, I'm happy to go into that at the end. So here's the exciting part, because, when I think about the clients, that's what is always the best part of our job, right? Is seeing how clients progress and transform along the way. So this client, she was actually one of our very first Ultherapy clients. And this picture was her 6 months later after her initial mid-lower face and neck treatment. So her energy was along the cheek, the jowl, underneath the chin, and along the neck. So about 6 months later, it's sort of funny because she was like, I'm just not sure if this worked or not. So I'll never forget that conversation, because as a provider, all of us want our clients to be thrilled. And I think the photo just does a great job illustrating, how she got that really nice subtle, the jowl improved underneath the chin, just definitely lifted and tightened. This client was in her mid 50s as well. She actually came to one of our Ultherapy events about 2 years ago. We did her treatment, and she did a full face. She did the cheeks, she did underneath the neck, underneath the chin area, sorry, and the neck. And we were just so excited that she got such a nice natural improvement. Her jowls are really the part for me that just stand out immensely. Very exciting, because she felt like she was going down that path and really didn't want surgery, and was debating about it and decided not to do surgery and try some non-surgical things, and she's been really happy with it. The volume underneath her chin as well is definitely improved. If you are at home and you're like, gosh, I really do have a little fat pad under my chin, would Ultherapy work on some of the fat under my chin as well? And Ultherapy, so it's a yes and a no. The ultrasound energy still goes underneath there, even if you have a little extra volume. But generally, we take care of the volume first with cool sculpting underneath the chin, sometimes submental liposuction, which you don't go to sleep for, or there is a medication called Kybella that is basically a fat buster, and it's an injection that breaks down the cell membrane of the fat cell. So sometimes clients that have a little more volume under the chin need fat reduction first, because Ultherapy doesn't really technically take away fat. It's all about the skin and the collagen. This client, however, this is the same client that was just in the previous slide, but just such a nice, wonderful result in the jowl and under the chin. So we were really excited about that. We tried to add in a little bit more of body types for under the submental area, just in case this might resonate with you. These are all just great examples of what you can see 3 to 6 months later after Ultherapy. The forward view, I would say this ends up being sort of that client, I would say in the 50s, maybe early 60s. And like I mentioned before, right, we can still make progress. It's never going to be as good as a face and neck lift, but as long as some progress is good for you, then I think we're all going to be on the same page and be happy. And sometimes, like these clients, I would say, hey, do Ultherapy, but then maybe you can also, meet with the skincare girls and do treatments on your neck for the surface of the skin. Neck is always very difficult. As I've aged and as I've hitting my 50s, I think we're all living the neck. It's definitely a challenge, and the neck is one of those things that definitely shows our age. So Ultherapy definitely has its wheelhouse for neck. And then sometimes it's also working on the surface, microneedling, facials, lasers, all those things can work on the surface of the neck. We're going to give you some examples of the décolletage treatment. So the chest area, of course, is FDA cleared as well. These, hopefully they resonate for you at home. The chest, I feel like the chest photos are sort of hard to capture sometimes. I think here you can just see that natural progression and the ease of some of the lines. We always say it almost is like a river, right? That goes from the collarbone down to in between the breast, unfortunately. And believe me, you can do laser there as well. So you can do Ultherapy, you can do laser later on. And some clients do Ultherapy once a year, and then they do some laser treatments on the surface. And that combined treatment is really beneficial. It does a great job for the chest. What we want to show you here is a client that was actually getting Ultherapy not long ago, actually. That is the transducer that is laying on the skin while I'm actually looking over my shoulder, of course, because you have to read the ultrasound every time you're delivering the energy. So you can see our client here is in a nice relaxed position. You're laying down like a facial. We have a pillow under your neck. She actually has numbing cream already applied, so you can see she appears really nice and comfortable. And yes, I was actually doing a treatment on her. She was kind enough to let us tape her. Um, and so all those, that is basically the position. And I would say, you know, you may want to know, how long does all therapy take? It really depends on your treatment plan. So when you have your consultation, depending on what treatment plan that you choose with your nurse provider, we'll be able to tell you, okay, you're going to be here an hour and a half. You're going to be here 2.5 hours. Of course, if you're doing all the way from the top of your head all the way to the chest, sometimes that can take us 2.5 hours, 3 hours. I often gauge, you know, when I meet the client, if I think they just might need a little more time, we just obviously schedule that accordingly. Every all therapy, and what we, you know, the one thing when we're used to doing our events in person, you know, the benefit of that is, like, you understand if you want to go ahead and schedule your complimentary consultation while you're here. So rest assured, you will be reached out from our CAPS family here in the next several days to see if you indeed want to do your one-on-one consultation. During COVID, we come with a mask, we do a screening, we do one-on-one consultations with you in the room. And we've been open since May 4th, and it's been going absolutely wonderful with all of our adaptations to the current situation. So we do recommend a complimentary consultation, because that's really the only way for us to know if this is the right thing for you. We always do individual photos prior to any treatment. So sometimes that's in the consultation, sometimes it's the treatment day, but just rest assured, like when we go through some subsequent photos, you will have those individually for your, you know, for your own treatment plan, because we're going to do follow-up photos with you at 6 months later. Of therapy. So sometimes they're like, okay, let's be honest. Some things are not as lovely as just having a lovely facial. So of course, because we're driving the energy below the surface of the skin, we like to say all therapy is somewhat spicy. What happens is it builds heat because we're delivering, we need the energy to bypass that top layer of the skin to give you the thermocoagulation points where we need to. So we always do 800 of Motrin 1 hour prior. We have that here for you upon arrival if you didn't take it at home. We always apply medical grade numbing cream, which we have here at CAPS. Some clients choose to do that at home, which is totally fine. We can dispense that for you. Some clients wish to do their numbing here at CAPS, which we're happy to do that too. I always say we'll individually customize it for what is best for you. We also, you didn't see this with our example client of the video a few slides back, mostly just because we wanted to show you how we glide the handpiece around the skin, but we also have nitrous gas that we use. And honestly, it's very short acting. It enables us to keep you comfortable. A lot of times clients have used that before at the dental office. It's absolutely safe to do so. And the half-life of it is so short that when you complete your treatment and you're done with the gas and the treatment, you can absolutely drive home. By the time we cleanse you and put some nice comforting products on, you're good to go and you're totally fine to drive. So that's the beautiful thing that we are able to have, because we are a medical spa, of course. So then, as far as when we see you, generally we see you in follow-up 3 to 6 months later. A lot of times I'll happen to see my clients because they're here for facial or lasers, or maybe they're seeing one of the physicians for their Botox and whatnot. So we can always see you sooner, but generally about 6 months is when we like to see you in follow-up. So when we do so, we'll do your photos, see what you're thinking, talk about your goals. And that way we can also help you know, like, if there's other modalities that we need to add into your overall treatment plan. So essentially, immediately, you do see some slight lifting and tightening, okay? A little bit of plumping of the fine lines that you have. You can have some minor swelling. Generally, there just really isn't any downtime because the energy is going below the skin. Of course, is there a little risk of bruising? Yes. Sometimes are you a little achy and numb on the surface of the skin just from the energy? Yes. But in general, there really isn't much downtime. You know, our big joke right now in the arena of mass right now it's a great time to do pretty much anything because we're behind the mask most of the time. So about 3 months after treatment, you're starting to see the lifting and tightening and that full effect about the 6 months. And it's really the same thing for the décolleté. Sometimes we see a little transient swelling right at first. So that's not really what the final outcome will be. So we just want to make sure that you're educated in that respect. So I think what people, just from events in the past, what people really want to see is more client outcomes to see if you can resonate and relate with these photos. This client, mid-50s, okay. We happened to catch her follow-up about 9 months after treatment, but we really like the way her jowls were improved. This client we happened to see at the 3-month mark, but absolutely around that submental area, right under the chin, is better contoured. The lift and the tightening here is just a much more pleasant and aesthetically pleasing presentation. This client did full face and neck, and so her idea for Ultherapy is really more of that, hey, I want to stimulate collagen around all the parts of my face. So you can go to the forehead, above the brow, around the cheeks, do the jowls, and you can see a really nice improvement there underneath her chin. This client she was about 47 at the time of the treatment. And we basically, what was driving her crazy, she's like, this drives me crazy, is the area right underneath the jawline and how the necklines were presenting just on the surface of her skin. So we were really excited about how the contour, even though, let's face it, she's aging really beautifully in her 40s. And this was a really nice, subtle, she didn't need a lot, right? She didn't need surgery. She didn't need some super intensive treatment. Ultherapy did a really nice job at giving her that contour underneath the chin that she desired. This client was 42 at the time of treatment, and what we saw for her is definitely a better contour up along that jawline and a better lift around that cheek area. Hopefully you can all see that at home. This client is super lean, and a lot of times clients that are really lean suffer from, they lose elasticity because they just don't have that, for lack of a better word, we want volume in our cheeks, right? We want volume where we want it. And unfortunately, as we age, oftentimes we lose it in our face and neck. And then that's where the skin starts to sag. She got a really nice improvement around her neck, up underneath her jawline. And she did end up doing, I'm not sure you can really tell in this photo, but we did add a little filler. The physician added a little filler in the cheeks to help give her a more aesthetically balanced presentation. This one, I was super thrilled. This client, we were able to catch her follow-up a year later. And so if you can see it at home, I hope so, because her neck, her chest lines were pretty dramatically improved. And what I loved is that a year later, it was still looking amazing. We have more before and afters that we love to share with you in your in-person consultation. We actually do the Ultherapy consults here in the Upper Arlington office, mostly just that because that's where our device is. I do have one of my providers, Tamara, that is in Easton, because she does skincare at Easton or here. So if you live on the east side or Easton's a better option for you, Tamara can do your consultation at Easton. Otherwise, the rest of us are all at Upper Arlington, and you can get your consultations really Monday through Saturday. We have multiple options for you. Laura, the program manager, is going to pick 2 lucky winners, and we're going to be doing a gift card. See if you would like to take advantage. We have B12 injections here at the Wellness Center at CAPS. And then she's got travel size products. So Laura, she gets the fun job of finding 2 lucky winners. So every time we do an event, we try to do a really fun promotion that gives you a really exciting discount that we don't offer on just a day-to-day basis. So of course, I wanted to let you know the consultations are free. When and if you end up doing a full face and neck therapy treatment, now that cost is $34.95. The chest, we're going to do at no cost. So it's really exciting because the chest is usually a $1,400 procedure, and we're absolutely waiving that. for you taking the time to attend this webinar, which we truly, truly appreciate. What I'm going to do is kick it back to Laura and see if anyone has any questions or anything that I can clarify or review. Laura, can you hear me?
Yes. Thank you so much, Jen. That was fantastic information. Thank you. Thank you. We did have a couple questions come through on chat during the presentation. The first one was, this is a great question. Are there any restrictions on working out if I did an Ultherapy treatment?
So during the Ultherapy treatment, because like I mentioned, you're here for 1 to 3 hours, I usually say, if you want to get your workout in that day, you really could do it after. There isn't technically any restrictions. You may not just feel like it that day. So I say, do it before, but you can absolutely work out, do yoga, do anything that you do activity-wise, literally the next day. So you don't really have any like activity restrictions as far as physical activity. That's a great question.
Perfect. Here's another great one. This is kind of a two-part question. Do I need any special skincare products for recovery after an Ultherapy treatment? And would I have to wait to get a facial after a treatment?
So in general, what we talk about spacing out treatments on our skin around the Ultherapy. Generally, if you're doing a laser or a microneedling or a dermaplane or a hydrofacial, because I know many of you may be members and you're here, and if you've never been to CAPS, I should have said welcome, because I feel like I might have forgot that. But you're absolutely always welcome to do a complimentary facial with our estheticians as well. But generally, we say a good rule of thumb is to wait about 2 weeks for any other treatment. So that way, if you've got a facial or you did a laser, wait 2 weeks, and vice versa. If you've just done Ultherapy, wait about 2 weeks, for a skin treatment on the surface. It just gives everything a time to rest, not have inflammation. In case you have a little bruise or any little issue, we just know we're sort of having a clean treatment for a couple weeks. And Laura, I feel like you asked me another part. Oh, the products.
Yes.
You don't actually have to have any special products for Ultherapy. We're always happy to give you recommendations if you're not already on a regimen. There are some wonderful products. Elastin comes to mind. They have a skin complex that's made especially for the neck, that I know a lot of our clients in Ultherapy. I think neck is one of those big things where we're all like, we get our skincare, we're doing our face. It's the neck that's really baffling to us as we age. So Elastin does have a really great product, but by no means do you have to buy it, but it's definitely available. But as far as you can use your normal skincare the night of Ultherapy, because we're not innervating or doing anything ablative or resurfacing on the top of the skin. So you can use your own skincare.
Perfect. I have a couple different versions of the same question for this one. So kind of, again, a two-part. Can I get Ultherapy if I get Botox and filler? And would Ultherapy make my Botox or filler go away faster?
Okay, great question. So and it's sort of the same rule of thumb as if you're doing laser or facial treatments. So I would say wait about 2 weeks for when you do Botox or filler, okay? With that being said, sometimes clients are just getting Ultherapy from the cheek down to the collarbone to the chest. So if you're not treating the forehead, you can do Ultherapy anytime. So hopefully that's not too confusing. But when you're here for consultation, we'll always look at your overall plan in case you have a physician appointment pending, et cetera, because we definitely would not want to put the energy over on your forehead if you're just getting Botox. When we talk about filler, oftentimes clients are getting filler. I'm going to give you an example of Voluma, which is a volume building filler protein that the physicians put along the cheek bone right under the eye, and it builds volume. Well, we really don't do the energy right directly over that area. We are able to see it on the ultrasound, and we actually deliver the energy lower than that and below. So, and then the other area people get filler is in the nasal labia folds, the corner of the nose down to the corners of the mouth. And there's a marginal mandibular nerve there, and we actually don't go over that with Ultherapy. So we do know how to avoid, and just make sure you're safe with all that. So that's a great question.
Thank you so much. That was fascinating. It amazes me that you can actually see the filler. I think that's amazing.
Yeah, we scan over it, but we obviously won't deliver the energy over that.
I love that. One last question, and then I also want to say there are some more questions here that if we did not answer your question, we will get to everyone. We will send an email to you with any answers that we get to right now. But I want a question here is, how do you know if it's fat or skin laxity under your chin?
Great question. I would say consultation really is the best way to know. And obviously, we're really used to assessing clients. All of us will know whether you need a physician consultation. We can educate you on if the fat needs to be addressed prior to all therapy, if submental is your primary area of concern. We can teach you more in depth about what options they are, what the cost is, sort of what the outcomes would be, and when the fat sort of goes away, you know, depending on the goals. So we're definitely used to covering all of that in your consultation. And really, honestly, in-person assessment is the big thing. Because perhaps with cool sculpting under the chin, though, it is the one area that cool sculpting allows us to say, the FDA says we do get some lifting and tightening with cool sculpt. But of course, that's the only area that it treats. So it doesn't treat the forehead, the cheeks, the jowls, the neck. So when you come, we'll definitely educate you if we need a little bit of like a dual modality of it, just to make sure you end up getting the right outcome that you're desiring.
Perfect. Thank you so much, Jen. And I just want to remind everybody two things. One, if we didn't get to your question, we will be answering you via email. And two, please call the office and schedule your no-cost consultation for Ultherapy. We will be reaching out to everyone that attended the Zoom event tonight. But if you want to dib on the appointment times, please give our office a call in the morning. Our phones turn on at 8 tomorrow morning, and we will get you all set up for your no-cost consultation with one of our amazing Ultherapy nurses. Thank you so much, Jen. I really appreciate it.
Thanks, Laura. And our main number is 614-246-6900. And we're here for you anytime if you have questions. We look forward to meeting you.